Hello, you're welcome. My name is Dr. Chris Williams, and I'm your host on Well Again. Well Again is your online health magazine program in which we look at field-proof principles for retaining health and regaining health when it is lost. Okay, we are creating some awareness concerning fertility, and we are treating today overcoming female factor infertility. Overcoming female factor infertility. Okay, using both the orthodox and then the alternative, okay, complementary approach to overcoming female factor infertility. First and foremost, what are the causes of female factor infertility? Maybe before we even go there, I need to remind you that 30%, just only 30% of all cases of infertility is due solely to a challenge to the woman. Okay, another 30% is due solely to a challenge in the man. Another 25% is due to a challenge both in the man and the woman at the same time. And then there's a 10% to 15% that is unexplained. In other words, doctors can't tell the reason. The man doesn't have an apparent problem, the woman does not have an obvious problem, but somehow they are still struggling with infertility. Infertility, by the way, is inability to conceive after 6 months to 12 months of unprotected sex, unprotected adequate sex. Adequate meaning 3 to 4 times a week, taking place especially around the ovulation period. Okay, and then it is unprotected, it is adequate, it is it takes place around ovulation period. So when this has happened for 6 months and to 12 months, the couple are not taken in, then we say there's infertility. So today we want to look at how to overcome female factor infertility. The way to do it will be to start with the most basic. Okay, is this woman meeting her husband? Are they having coitus very regularly? Is it up to 3 to 4 times? And when it happens, does her husband ejaculate into her, or he ejaculates outside, or he never ejaculates? Okay, it's a cause. So inadequate sex can be a cause. It can be a female factor. If the woman is having pain during sex, or she doesn't just like it and all that, it can be a factor. Now, even if she even when she has been she's able to do adequate sex, but and then it's also able to receive sperm from seminal fluid from her husband. Another cause may be if she's not having adequate cervical mucus. Around about ovulation, the mucus, some women know this, the mucus that the cervix produces becomes very thin, transparent, and stretchy. It is this medium. This is the medium that is most adaptable to the sperm to flow or to swim in. If somehow that mucus being produced is inadequate, it can cause infertility, can cause difficulty in getting pregnant. If it is hostile, in other words, there's a anti-sperm antibody inside it, something something that attacks the sperm, it can also be a cause. Or even if it is infected, it can cause it to be acidic and hostile to the sperm. So if it is inadequate, if it's infected, if it contains some anti-sperm antibodies, those are antibodies that can destroy the sperm cells, it can be a cause. And this can be all this can be if the cervix is infected, or if it is scarring, maybe during previous D&Cs. The cervix has been scarred, it has been wounded, it has healed. Scar, SCAR, it can cause that. So cervical issues can cause that. All right. Another cause of female factor infertility is we're going up now is in the uterus. if the uterus is not the inside of the uterus is not smooth enough. The uterus on ultrasounds looks like this. The inside has to be very smooth for to be able to receive the fertilized embryo. Okay, now if the inside is not smooth, either because there's fibroid or there's polyps, it can cause a problem. Or maybe the uterus is not one, it is two, or it is divided, or it is jagged, or it has what we call Asherman syndrome. That's adhesions because of previous infections or scarifications, or maybe D&Cs. They have been wounded, so the uterus is, instead of being a nice hollow place, it is gummed together. It can be a problem. Okay, so that can also be a problem. If it has fibroid, if it has polyp, like we said, it can be a problem. Another problem is if there's tubal blockade. Now, tubal blockade is when, either because of infection or because of previous operations in the abdomen or in the uterus, in the tube is scarred. It is scarred, it is wounded, it has adhesions, or it is blocked. Okay, so tubal blockade can be a problem because the fingers of the tubes, called the fibra, has to pick the egg that is released and then send it down through the tube to somewhere close to the uterus where fertilization takes place. Fertilization doesn't just take place anywhere, it takes place somewhere close to the uterus. Okay, so that can also be a cause. So tubal blockade can be a cause. And then another thing that can be a cause is ovarian dysfunction. Ovarian dysfunction. If a woman is having ovarian dysfunction, it can be a problem. So if a woman is having ovarian dysfunction, in other words, the ovarian reserve is less than it should be. What do we mean ovarian reserve? When at formation, in the first 3 months or thereabout, or while the baby is still in the womb, God gives the baby, if it's a girl, all the eggs that she will ever use in her lifetime, even if she lives to 120 years. Now, because a woman releases an egg per month, a woman releases at least an egg every month when she menstruates. Now, while in the womb, the eggs there are about 7 million. By the time she is born, the eggs are about 700,000. By the time this woman is 25, the eggs have dropped to round about maybe like 300,000 or thereabout. And by the time this woman is like 30, the eggs have dropped to about 25,000. Now, in some women, it can even drop less. That's what we call ovarian reserve. Ovarian reserve is talking about the eggs remaining for the woman to shed or to release during menses. Now, if there's ovarian dysfunction, there can be problems. It can lead to inadequate ovarian reserve. There are many ways that we can tell if a woman is having ovarian reserve shortage. Okay, many tests: clomiphene citrate challenge, intrafollicular count, or use of AMH, anti-Mullerian hormone. Anti-Mullerian hormone is actually the best because it does not fluctuate. In some centers they also use follicle level of third day count of follicle stimulating hormone and LH hormone between luteinizing hormone, between day 21 and day 23 in a 28-day cycle. Okay, but the best so far is the anti-Mullerian hormone. It does not alter, it does not change. It is constant throughout the course of the month. Okay, it's constant throughout the course of the month, so it can be used to tell us the ovarian reserve. Usually, if it is between 1 and 3, it is considered to be normal, okay, especially around 3. But if it's going to 1, it's less than 1, then the ovarian reserve is short. Sometimes the ovarian reserve can be too much if it is more than like 7, and then that may be a discussion for another day. Okay, so if there's ovarian dysfunction, there can be a problem. There can be a problem. In other words, if the follicle stimulating hormone that is released in pituitary gland and in the luteinizing hormone are not released, are not having their due effect on the ovaries, there can be a problem. Also, if ovulation is not taking place, ovarian reserve can be normal, but if ovulation is not taking place, remember I said ovulation is releasing of that hormone. If it is not happening, there can be a problem. There can be a problem. Most women ovulate. If a woman's cycle is between 28 days and 32 days, then she most probably ovulates. But if it is less than like 22, and it is higher than 35, that woman may have issues. The lesser than 28, the higher than 32, they begin to have issues with ovulation. They may still ovulate, but some of them may ovulate like 6 cycles in a year. That's 6 months out of 12 months, or 5 months out of 12 months, something like that. All these are, so what are the other causes of female factor infertility? We have talked about tubal blockade, we have talked about ovulatory problems, we have talked about cervical problems, we have talked about uterine problems. Okay, PCSO, polycystic ovarian syndrome, it's a syndrome on its own. It's usually associated with obesity. It can also be a cause of female factor infertility. Okay, obesity itself can also be a factor of male factor infertility. All right, hormonal imbalance, lack of FSH, lack of luteinizing hormone, lack of progesterone, lack of prolactin, or too much prolactin in the body, or excessive testosterone in the blood of the woman, thyroid stimulating hormone if it is less. All these things can cause the woman not to be fertile. You know, along the line somewhere, fertility starts from the brain and ends up in the ovaries or in the uterus, as the case may be. Okay, so that can cause that. Other causes of female factor infertility are causes like endometriosis, the freezing of the organs in the pelvis, the uterus, and gets matted to the tubes. The tubes is matted to the peritoneum, and all of them just gum together, and there's a problem. Chronic infection, untreated infection, PID, pelvic inflammatory disease, can cause an infection, and there's just confusion in the whole pelvis. Okay, there are some other things like congenital anomalies, uterine septa, uterine biconate uterus, all these things, and some other ones that we may not have talked about, may be the causes of female factor. Now, what will be the treatment? It's important. Don't forget, we are not prescribing, we are just telling you for information. If you need to know more, you need to call us, and then we'll be able to refer you to some of the doctors we work with, or we refer with, if you like, you see us at our center. Okay, in some months from now, we should be starting in collaboration with some people an IVF center, and then you can also do that. So what are the things? Number one, the diet. You want to pay attention to your diet. It's so very important. High fat diets, plenty of oils, eating of sugars and sweet things, abuse of caffeine, alcohol, drugs. All these things make the woman's body infertile. Okay, abuse or very long use, prolonged use of oral contraceptives or injectables or insertions also cause a disbalance, an imbalance in the woman's body. Okay, so what should you do? Stay away from all those diets. Stay away from putting things into your body that would destroy or derange your fertility. Go for green leafy vegetables. Okay, eat grains, but not wheat, not wheat, not wheat, not wheat. I'm saying that for emphasis. Wheat and flour foods contain gluten, and they can destroy the body. They can destroy the body's fertility, both in the men and in the women. But other grains, millet, oats is sweet. Oats, millet, guinea corn, these are very good. You want to eat rice, eat basmati rice and all that. Okay, beans and lentils, they are also very good foods to eat. Okay, make sure you are taking alkaline water, or water that is alkaline, not too acidic. Alkaline environments help fertility. They help fertility. Okay, drinking of blended vegetables, cucumber, cabbage, carrot, beetroot, blended vegetables, and drink them help to restore the woman's fertility. Okay, what other things should the woman do? Lifestyle and stress. You need to remove stress. Stress is okay, I didn't mention it. Stress and lifestyle abuse, worry, anxiety, these cause infertility, and if the woman needs to deal with it, 5 hours to controlling stress: rest, renew your mind, don't let things stress you, recreation, relaxation, and refill using of some supplements. There are supplements that can help to deal with stress. Okay, there are supplements that can help to deal with stress. What other things? Use of medical drugs. Now a practitioner needs to be able to recommend this to you. Drugs need to be recommended before you can use them. But there are drugs that they use. They can use clomiphene if the tubes are not blocked, and if all the things are in place. There's something called clomiphene citrate. It helps to induce ovulation. It helps to also stimulate the woman. Okay, if the prolactin is too high, there's something called bromocriptine and pallodel that can help to bring it down. If the woman is battling polycystic ovarian syndrome, we can place her on metformin. Metformin is also used in diabetes, but not to worry, it will not drop the woman's blood sugar. It can also be used. Now, so those are that. Having done all that, I didn't talk about investigations. We need to investigate this woman. We need to check our follicle stimulating hormone, luteinizing hormone, testosterone, progesterone, prolactin, and thyroid stimulating hormone. If all these ones are deranged, then we can use these drugs, the different drugs. Okay, there are different things that are given, and practitioners, and if you visit a center of excellence, they know exactly what to do. Okay, there's also surgery sometimes. For instance, blocked tubes can be flushed. It's called tubal recanulation. It can be flushed, and then if there is endometriosis, for instance, it can be released. If there's Asherman syndromes, it can be released also. They can go in there. They can use laparoscopic interventions to help this woman. If you call in, we'll be able to tell you and explain to you some more. All right, lastly, herbs and supplements can be used. Any woman who is believing God to be pregnant should be on zinc. She should be on folic acid. She should be on omega-3 supplements. She should be on bee pollen, bee propolis. She should be on royal jelly, and then some herbs like Damiana, Vites, Donquai. These are very good also, and also wild yam roots. Just this is all we'll be able to take here. Don't forget, these are not prescriptions in any way. We are just letting you know the information. Now, beyond all this, some other things can be done for the woman, like Iui Intrauterine Insemination. They will take the sperm, wash it like that, and then insert it in the uterus of the woman. IVF can also be done, and many people are skeptical about IVF. If we do it in centers of excellence, I just told you that we are working very hard at starting an IVF center, myself and some of my colleagues, and it promises to go very far. Now, IVF is literally you take the eggs, you capture it, you stimulate the woman, you retrieve the egg, you put it in a petri dish or somewhere in the lab, and then you take the man's sperms and then you deposit them and mix it with the eggs, with the hope that one of them will swim into the eggs. Okay, that's IVF. There's even something more advanced, and our center promises to have that. It's called Iui Intrauterine Sperm Injection. Here you take the sperm under very, very high level, high magnifying microscope. You remove the shelter, the shield around the egg, and then you take that sperm and inject it into the egg. Very technical process, but it usually takes the result of IVF to another level. While the normal IVF will have fertilization success rates of like 40%, Iui will have fertilization success rates of like 75%. It's important to say, however, that fertilization was achieved in the lab does not necessarily guarantee that the woman will become pregnant. It's so very important. It's so very important. So while fertilization rate may be 75%, getting pregnancy rate may be like 30, maybe like 40%. All right. I would like to stop here. If you have any questions, do not hesitate to contact us so that we'll discuss this, and then we will tell you whichever way where you fall in. Okay, whether it's the medical approach or we'll begin to use assisted reproductive techniques for you. Now, I would like to remind you, we have not prescribed, we have only given you information. Please help us subscribe to this channel and tell people about this channel. Also send this URL to some persons you know who are battling with infertility. The earlier people start, the better. What I see in my practice many times is people who have been waiting for 5 years, and then the 5th year you ask them, have you done anything before? They say, no, this is our first time. That's very wrong. After 6 months, even 1 year of waiting and nothing has happened, start seeing doctors so that it will not be too late. Okay, very, very important. It won't be too late for you. All right, so subscribe, turn on your notification, and then help us spread the word. Very, very important. Also, we have our books, Reversing Diabetes Naturally. It's important. Reversing Depression Naturally. It's important. Sickness Free. It's a very powerful book. It's also available on sale. And then this book by Daniel Ekele, Living a Disease-Free Life, it's also available. And then Make Your Food by Your Medicine, it's available. Watch us on Wale Adenuga Productions TV, WAP TV, Monday mornings 8 a.m. and then also on Dove Television Monday evening 7 p.m. of every week. Also follow us on Facebook. Address there is Chris Williams, and then on YouTube like this, subscribe here, Dr. Chris Williams is our YouTube page. You see a whole lot of videos there that will be beneficial to you. And then you also contact us on WhatsApp. Contact us, send us messages on WhatsApp, and then we'll be able to reply. Thank you so much for watching. Bye bye. God bless you.